Hi, my name is Bianca Runauer. I am going to talk about 6-month randomized multicenter trial of closed-loop control in type 1 diabetes. Definition: Type 1 diabetes is a chronic condition in which the pancreas produces little or no insulin. Insulin is a hormone needed to allow sugar to enter cells to produce energy. Different factors, including genetics and some viruses, may contribute to this disease. Usually appears during childhood or adolescence. It can develop in adults. Type 1 diabetes has no cure. Treatment focuses on managing blood sugar levels with insulin, diet, and lifestyle to prevent complications. Closed-loop system that automate insulin delivery may improve glycemic outcomes in patients with type 1 diabetes.
About 10% of people with diabetes have type 1. It's got nothing to do with diet or lifestyle, it just happens. When you have type 1 diabetes, your body attacks the insulin-producing cells in your pancreas, so you can't produce any insulin at all. And we all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our bodies. When you have type 1 diabetes, your body still breaks down the carbohydrate from food and drink and turns it into glucose. But when the glucose enters your bloodstream, there's no insulin to allow it into your body's cells. More and more glucose then builds up in your bloodstream. So what does this mean? Well, before diagnosis, your body tries to get rid of the glucose through your kidneys, and that makes you wee a lot. Weeing so much leads to another symptom of diabetes, extreme thirst. Because glucose can't enter your cells to give you energy, you'll feel incredibly tired. To try and get energy, the body breaks down fat stores to provide fuel. That's why people often lose weight before discovering they've got type 1 diabetes. These symptoms tend to come on quickly, over just a few days or weeks. Anyone who has these symptoms should see a doctor as soon as possible. If you've got type 1 diabetes, you get insulin into your body by injecting it or using a pump which delivers a constant supply into you. You'll also need to check that your blood glucose levels are not too low or too high by using a blood glucose testing device several times a day. When you start taking insulin, you'll begin to feel better, and your blood glucose levels will go down. This is important because over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, the long-term effects of diabetes and high glucose levels can be managed. You can find out how we can help you manage your diabetes on our website. We're still not sure why some people get type 1 diabetes and others don't, or why the immune system of someone with type 1 attacks the cells that produce insulin. But our researchers are learning more and more about type 1 diabetes, so we can develop new treatments and one day find a cure.
Applications in medicine. Closed-loop system, commonly referred to as an artificial pancreas, combine a continuous glucose monitor and insulin pump to regulate a user insulin with minimal interaction required from the patient. This technology connects with blood glucose sensor and insulin pump to automatically increase, decrease, or stop the delivery of insulin in response to the glucose levels of people with type 1 diabetes.
Number 1. Hybrid closed-loop insulin delivery system.
Nighttime brings about the most fear in parents of children with type 1 diabetes, relinquishing all monitoring control and relying on the unpredictable pancreas. Millions of type 1 diabetes sufferers rely on the use of an insulin pump, providing an alternative to multiple daily injections. However, that open-loop system requires the patient to determine how much insulin the pump injects using information from a continuous glucose monitoring device, or CGM. Now, there is a revolutionary breakthrough removing the patient from the equation. In 2016, the FDA approved the first hybrid closed-loop insulin delivery system. Being hailed as the world's first artificial pancreas, the new technology enables direct communication between the CGM device and the pump. Making type 1 diabetes management easier than ever, studies show it stabilizes blood glucose at an unprecedented level, dropping A1C levels 0.5%. Hybrid closed-loop technology is predicted to have a huge impact on the diabetes treatment market and is a big step towards developing a fully automated insulin delivery system.
Pros and cons. Pros. The closed-loop system used for 6 months led to a great percent of the time that the glucose level was in a target range, less hyperglycemia and hypoglycemia, and better glycated hemoglobin levels than a sensor augmented pump. Cons. There was a diabetic ketoacidosis, which is a serious complication of diabetes that occurs when the body produces high levels of acid in the blood, called ketone bodies. The disorder appears when the body cannot produce enough insulin.
Pros. Accurate delivery. Using insulin pumps means that the dosage will be precise. Unlike normal insulin injections, with pumps, you can deliver doses far lower than you could with a syringe. More flexible. Insulin pumps are more flexible for people who like to snack or eat at odd times. While it's important to follow a strict eating pattern, the truth is that many people give in to temptations every now and then and cheat on their diet. The insulin pump will allow the patient to deliver multiple boluses easily. Not only will you be able to track the effect of the bolus, but you can deliver more insulin if the meal was large and required it. Range of basal rates and patterns. Different people have different basal rates. In fact, the same person could have a different rate at different times throughout the day. Insulin pumps can be programmed to handle temporary basal rates and patterns. It's a lot easier to do this with pumps than syringes. Suitable for children. Of course, it goes without saying that pumps are designed with child safety features. Using a pump will mean that the child has the correct amount of insulin delivered. Children, just like adults, tend to fear needles and the pump looks less scary. Cons. Constantly attached. One of the cons of insulin pumps is that it's constantly attached to you. You need to wear it daily, all the time. Some people may not like having a device stuck to them for so long. Can be embarrassing. While not as embarrassing as ankle monitors that are worn by people under house arrest, insulin pumps are visible and a constant reminder that you have diabetes. No matter how small the device is, some people may feel embarrassed or think that there's a stigma attached to it. Skin problems. Of course, any device that rubs against your skin over and over may cause irritation and skin issues.
Issues apply in Ecuador. In Ecuador, unfortunately, for the time being, it is not planned to test the system in hospital because it still wants to demonstrate the profitability of this system through large clinical trials and because of the high cost of healthcare. Conclusion. Type 1 diabetes is a chronic autoimmune disease in which the body immune system is destroying the beta cell of the pancreas. Beta cell secretes insulin, a hormone that transports glucose into the cell for energy. In this 6-month trial involved patients with type 1 diabetes, the use of a closed-loop system was associated with a great percent of the time spent in a target glycemic range than the use of a sensor augmented insulin pump.